Apollo Hospitals, Chennai, and Medical Director, Capstone Multi-Specialty Clinic, Chennai. So with his expertise and, with his knowledge and experience, he will help us understand the prevalence, the situation, what is influenza, the different types of strains that are there, and what are some of the preventive strategies that we can adopt as a country and as a state. And along with him is Dr. Jijo Karan Kumar. He is Director Medical Affairs for Abbott India. So I'll very quickly hand over to Dr. Ramasubramanian for his opening remarks.
Thank you very much.
So before that, we just want to, kind of. Thank you, Dr.
Would you like to take that for you? Thank you.
My pleasure to be with you this afternoon, and I'm very happy that we are talking about a subject which I think everybody should know. Flu is a virus which has been with us for several centuries. I think all of you would have heard about the 1918 flu pandemic. When the COVID came in, we all was mentioning about the 1918 Spanish flu, which was a pandemic all over the world. And it is believed that the number of people who died, which it had caused on people. So that is one spectrum of the flu. That was a very serious pandemic. But we still have the flu. Every year it affects millions of people. It is believed at least 5 million people suffer with flu every year, and probably many more who may have a subclinical infection. The flu typically causes a sudden onset of body pain, a little bit of a runny nose, cold-like symptoms, scratchy throat, and this is followed by fever, quite often 101, 102 with a lot of pain. Patient is really poorly for 2-3 days. Then the fever improves and settles, but the person may be left with a very bad cough and tiredness, which may persist for several days and sometimes even weeks. So this is how a typical flu presents. Now this has to be differentiated from the cold. The cold typically causes a runny nose, a stuffy nose, a little heavy head. You feel feverish. Temperature rarely crosses 99.5. So the presence of a significant fever and severe body pain is the main factor which distinguishes a flu from a common cold. Common cold is usually trivial. You are down for a couple of days and then you are back to normal, whereas the flu can even kill. Anybody can get the flu, but if flu affects young children less than 5 years, if it affects people over the age of 65, or people with other what we call as comorbidities, people with diabetes, hypertension, heart disease, lung disease, kidney disease, this can cause a severe pneumonia, just like the COVID. When you get a pneumonia, it can lead to hospitalization, ICU care, ventilation, and even death. So young children, elderly people, people with comorbidities can have complicated flu pneumonia, which can even lead to death. So when we read in the papers, 2 people die of flu, it can happen. It is not unusual. It is only the fact that we are picking it up better. The flu, how you react to the flu, and what you do to prevent yourself from the flu. Do I stop here?
Also, at a larger community level, what is it that we could do to protect against the flu?
Right. Now this is preventable. It is not something which we have to go through because it is flying around. There are 2 or 3 things I would like to highlight. One, especially if you have the symptoms, if you have the fever, the cough, or you're feeling really lousy, runny nose, coughing, sneezing, please stay at home. When you have these symptoms and go and work, especially in a gathering like this, and you cough, you speak, you breathe, you can transmit the flu. And the flu is similar to COVID, which is through the respiratory droplets. So if you cough, the virus attaches to the small phlegm which comes out from your mouth and nose and drops to about 3 to 6 feet near you. So anybody in this vicinity can pick it up directly, or if you cough or sneeze and the secretions fall here and somebody touches it and takes to their nose, they can get it. This is very similar to COVID. So one, if you have the illness, please do not go and spread the cheer. 2, especially when flu is around, keep your hands to yourself. Do not touch your face. Do not touch your eyes. Do not scratch your face. Do not touch any object which may have been contaminated. Take your hands near your face. That is how you get it. So these are the 2 fundamental principles. But the more important issue is to understand that there is a vaccine for flu which can prevent to a significant extent both flu and its complications. So this flu vaccine is available every year depending on what is the type of flu strain which is circulating in the world. Now, flu virus is notorious for undergoing changes, what we call as mutation. Mutation is a change in the gene, the genetic component of the virus. This keeps changing every few months. So what circulated last year may be completely different from what is circulating this year, or what may circulate 2 years down the road. So depending on what the circulating strain of the virus is, the World Health Organization has surveillance centers which collect data in the northern hemisphere and in the southern hemisphere. And based on this data, they will inform the vaccine manufacturers the likely strain which is going to circulate in the next 6 months. And based on that, the vaccine is produced every year. So every year the vaccine strain may be different, and by taking the flu vaccine, we protect ourselves from what likely flu strain which circulates that year, thus preventing probably not only the flu, more importantly, the complications of flu.
Thank you, Doctor. That prevent the at-risk groups that we just mentioned about.
Please remember, one of the questions which people ask me is, so if I take the vaccine, I will not get the flu. There is no guarantee. The vaccine induces the body's immunity against that specific virus and brings it to a level thereby for about at least about 70-80% of the time it can prevent the flu. But even if you get the flu, it minimizes the severity and it prevents the complications. So a lot of people, no, I'll take the flu, but if you'll guarantee that it will protect, there are no guarantees. But this is the best alternative we have in preventing or suffering the complications of the flu. So the flu vaccine contains, usually the currently available vaccines contain 4 strains. You know, influenza or flu can be of different types, A, B, C and D. D generally doesn't cause problems in humans. A is the commonest strain of viruses which causes severe pandemics. B can also cause severe infections. C, very mild infections. So the flu vaccine contains 2 strains or 2 types of influenza A virus, 2 types of influenza B virus. So it's a quadrivalent vaccine. 4 strains or 4 types of viruses, 2A and 2B are in this. These are usually the circulating ones. So by injecting the flu vaccine, it stimulates the body to produce antibodies against these viruses. So when the flu hits you, the body recognizes it early and immediately kicks it out of the body, or at least makes it so weak that it does not cause complications. That is how the flu vaccine works. So it takes at least 2 weeks for the antibodies to be built up. Don't think that if you take the vaccine today, tomorrow you are immune to the flu. No, it takes at least 2 weeks. So take it at the earliest. The problem is these antibodies wane or decline over time. So generally after 6 months of taking a vaccine, the antibody level slowly comes down. That is why it is said that you need to take the vaccine every year. And the other reason is it may be a different strain of flu which is circulating. So these 2 are the reasons why it is advised you take an annual flu shot.
Thank you.
Are much higher in young children and elderly people, in people with comorbidities, and also people who are pregnant. Pregnant woman, if she gets the flu, it can lead to a pneumonia and even death. It can be a very serious affair. So in these groups of high-risk individuals, the flu vaccine is strongly recommended so that we prevent complications even if they get the flu. So obviously, yes, the main groups we target the flu vaccine is these 4. Young children, the World Health Organization has increased the age from under 5 to under 7 right now. So up to 7, the risk is believed to be very high. People over the age of 65 or even 60, I would say, people with diabetes, hypertension, heart disease, lung disease, kidney disease, transplant patients, patients who are on steroids, and lastly, pregnant women. But having said that these are the high-risk people who strongly need to have the vaccine is recommended for every individual above the age of 6 months. So each and every one need to take it. I take my flu shot every September when the new northern hemisphere vaccine comes in. I take it. Everybody is strongly advised the vaccine, which improves his productivity, which prevents loss of days at work, and prevents hospitalization and prevents death.
Thank you, Doctor. In fact, I was just...
Thanks a lot, Doctor, that you put the right perspective about influenza as a disease, and if infected, it can lead to complications and hospitalization. what I'd like to share with you is about what is the evidence suggesting about influenza and its implications. It clearly shows that if I take a high-risk population, which doctor just defined, that typically elderly patients more than 65 years of age, patients with comorbid conditions, can we stand?
Yes, of course.
If these patients are vaccinated with influenza vaccine, there's a 50% less chance of hospitalization if they are infected with influenza. So that is a protection what a vaccine can offer to this high-risk population. Now coming to children less than 5, there's a 57% reduction in the risk of hospitalization if they are infected with influenza. Now most importantly, for a pregnant woman, if they are vaccinated, there's less likely, almost 20 to 30% less risk of a preterm birth in a pregnant woman. So these are the patients who fall in the high-risk category and need to take a vaccination. So we do understand that in a patient with influenza, if they are vaccinated, it prevents all the complications. But still, there are a lot of barriers as to why vaccination is still a challenge out there in India. First and foremost, the most important barrier is that influenza or flu, as Dr. rightly pointed out, is still being perceived as a minor self-limiting disease. The patient would get the disease on one day and at a point of time it will just go away. But please note, influenza is caused by different strain of viruses. It is the H3N2 or the H1N1. Globally or in India, it is a major public health concern because in these patients who get influenza, if they're not well protected, they can lead to complications, they can end up with hospitalization. The second important barrier when it comes to influenza vaccine is that there is a lack or less knowledge or awareness about this particular disease or the role of vaccination amongst the doctors. We have a doctor who takes an annual vaccination, but believe me, there's a lack of awareness amongst the doctors as well as the public. So due to which the importance of taking a vaccination becomes a little self-limited. And especially in the high-risk population, we spoke about elderly patients, patients with diabetes, cardiovascular, renal disease. The focus out there is more towards a treatment rather than prevention. And herein, it is very important that these patients understand that vaccination would actually help them to prevent the complications of influenza. The third most important factor is vaccine hesitancy. Now, if you look at this word, vaccine hesitancy, globally, this is supposed to be the 10th most important threat to the global healthcare as defined by the World Health Organization. And what is vaccine hesitancy? There's a concern over the safety of the vaccine. There's a lack of trust. There's a cultural issue due to which patients do not take a vaccine. So these being the barriers about vaccination, our objective for today is to spread awareness about influenza as a disease. It is not a common cold, clearly been told by the doctor. There is a preventive measure, that is vaccination. Get vaccinated, you can prevent the complications or hospitalization. And the age-old wisdom what we all have in our doctor community, all amongst the people, that prevention is always better than cure. And that's the objective of this particular meeting you all come here for. To live life to the fullest. We have an Abbott 2030 policy wherein our focus is to raise the awareness about diseases, namely the non-communicable disease and the infectious disease. We truly believe that vaccination plays a very important role when it comes to influenza. So our endeavor is to spread the knowledge and awareness about influenza, the importance of vaccination. So we do started a campaign called as MY, Mothers Against Influenza campaign, somewhere in 2017. We do it every year where we go to pregnant women, we address them and we tell them the importance of vaccination. It will prevent them as well as for their babies to be born. So this is a campaign which we are doing year on year since 2017. We are also very active when it comes to the media, whether the print or the radio, as to the social media, where we do speak about influenza and the burden and how do we prevent all this particular process. Last year, we had a special campaign for the school-going children. Before the academic year started in the month of June, we went all to the doctors and spread awareness about influenza.
Thank you.
Highest, it may not be very reliable because the number of cases of influenza which is reported as that diagnosed by doing a PCR test is still very, very limited. In other words, if probably 100 people have symptoms, less than 5 actually have it tested. Maybe unwell, actually may have this test done. So it's a gross underestimate of what is happening. Two, rains even in March. So the occurrence or the peak of the flu outbreak is a little later in Tamil Nadu. So that could be another reason why we are seeing more cases this year. But in spite of all this, I think it is a huge underestimate of what is actually prevalent. You ask any practicing doctor. In fact, I can, stick my neck out and say that out of every 10 people who walk into my clinic consultation room, right now in the last about 8 weeks, 8 out of 10 people are coming with respiratory symptoms, cough, cold, headache, fever. And probably very few of them get actually tested because they don't need admission. But those who end up in the hospital, it's a different story.
Thank you for sharing that insight. I think that 8 in 10 is a number that, we need to take account of and act on it. Therefore, why prevention is better and prevention is a must, as stated by both Dr. Jijo and Dr. Ramasubramanian. With this, I would request, first Dr. Ramasubramanian to, kind of give his closing remarks, any key takeaways for our audience here today.
See, there is a reason why people don't take vaccines. Even in the US, even where vaccinations for flu are given free to doctors and healthcare workers in hospitals, working in hospitals, because we are the group which are at highest risk of both getting the infection and probably passing it on, because we have very close interaction with sick patients. The uptake of flu vaccine is probably only about 70%. So in spite of all that, you can imagine still the vaccine uptake is very poor, and in India it is abysmally low. It probably is about 0.5% of the Indian population who are eligible, who are taking the flu vaccine. The main reason is not, of course, awareness is a huge issue because very few people, you would have learned some things today. Availability of the vaccine may be an issue, affordability of the vaccine. So all these play, but most importantly, the reason I feel is there is something called the optimism bias. When you are healthy, you don't think anything can go wrong with you. So if it is HIV, I'm not bothered because it doesn't come anywhere near me. If it is flu, I'm feeling fine. Why do I have to spend a lot of money and get a vaccine now which actually will be painful for something which I may not get, or even if I get, I'll have 2 days and come through well. This kind of an insurance, vehicle insurance was not mandatory in India. Very few people will pay for insurance. Same thing was true with health insurance, but now people are realizing that if they fall ill, it's a very expensive proposition, so they feel it is safer to invest in health insurance. The same thing for flu also. It's a kind of insurance which you have to pay upfront to prevent a complication. It may or may not happen, but if it happens, it is bad news. So that is the reason why I think everybody should understand you have to be sensible, you have to think ahead and make sure you take the vaccine. And one more point I would say here, which is very, very rarely mentioned. Now, it has been very clearly shown that flu, the virus causes a lot of inflammation in the body. And this inflammation also happens with your blood vessels. So during flu season, we find that there is a significant increase in patients who are coming with heart attacks and strokes. In fact, a lot of people who have come in the last 2 months come with a history of 2 days of fever and then they come with a heart attack. 3 days of fever, they come with a stroke. It's because the inflammation which happens due to the flu virus infection causes what we call as cardiovascular and cerebrovascular accidents. So there is a direct correlation between the occurrence of flu and the occurrence of these vascular conditions. And it has been shown that the flu vaccine not only decreases the occurrence of flu infection, complications, hospitalization and death related to flu, it also brings down the occurrence of heart attacks and strokes. Because by preventing flu, by preventing the inflammation, you actually impact not only on flu-related complications which we are aware of, but also heart attacks and strokes. This is something which is not mentioned, but it is something we have to keep in mind.
Influenza is a vaccine preventable disease. A small prevention of taking just an annual influenza vaccination would protect you from the severe complications and hospitalization. The vaccines what are available, it does cover the strains what is coming out, whether the H3N2 or the H1. Vaccine does have protection for these different strains also. So I ended up by saying that influenza, be protected, especially the high risk population, including the healthcare professionals, because as Dr. rightly mentioned out, the healthcare professionals are the major risk because they have been exposed to the patients. Thank you very much.
Inaccurate. Vaccine is not a steroid. Vaccine is not causing side effects related to what you see in steroids. 5 years of vaccines will not, I don't know where this information has come from, but vaccine purely contains the antigen. It may have some excipients, some additions to stimulate your body's immune response against that, but definitely there is no steroid in the vaccination.
Doctor, you said only uptake is only 70% among doctors.
In the West, studies have shown that even there.
That is in India or?
No, I'm talking about the USA.
Yes.
In India, it is not given free. That's a huge problem which affects, because it comes from your pocket, that becomes a problem. So unless it is part of the national immunization program, kids are given free vaccines. Not all the vaccines, only some vaccines. So it depends on the country's priorities. It depends on the wealth. There is a lot of issues due to public health and programs. But in the West, where it is given free for doctors, even there they don't take it, because it's a feeling that I will not have a problem.
So in that case, the government should take efforts to give a free shots every year.
Oh, government should take a lot of efforts, but as I said, priorities are different. For example, more children die of diarrhea in India. More kids die because they don't even reach 5 years of age. That is probably a far more priority to the government than giving vaccines. So it's all how you look at it. It's a perspective.
But it should be affordable, how much it costs.
So here the purpose was basically to discuss with the awareness. We don't want to discuss about this aspect of price right now. So maybe first.
So this session is primarily on the awareness and giving more information on the prevalence, on what are the challenges, what we can do to prevent. So
because we are willing to spend, for example, I can tell you examples. We don't mind once a week going and eating biryani in a hotel and spending 2,000 rupees for the 4 in the family. But when it says once a year to take the vaccine, it's expensive. So it's again how you look at it. I know people who are promptly every August end they'll come to me and saying, "Doc, is the vaccine available? Let me take it." And these are not rich people. So of course, I'm not saying that money is not a question. It is, but there is something more than that.
Thank you, doctor. Any more questions?
Vaccine la 4 விதமான வைரஸ்க்கு கவர் பண்ற மாதிரி இருக்கு. இன்ஃப்ளூயன்சா A ல H1N1, H3N2, இன்ஃப்ளூயன்சா B ல 2 வெரைட்டி. சோ அந்த 4 வெரைட்டியும் இப்ப வந்திருக்கிறது. முதல்ல அக்டோபர் நவம்பர்ல H1N1 வந்தது தமிழ்நாட்டுல. இப்ப பிப்ரவரியில மார்ச்ல H3N2. இது ரெண்டும் நம்ம இருக்கிற வேக்சின்ல ப்ரொடெக்ஷன் கொடுக்கும். No. Flu is a different virus, COVID is a different virus. They have no you can get both together, you can get one without the other. Protection, giving vaccine for COVID will not protect against flu, giving flu vaccine will not protect against COVID.
Thank you, doctor, for mentioning that. I think that, yes.
கம்பல்சரி எல்லாம் இல்ல சார். இது நம்ம சொல்றது இது போட்டுக்கிறது உங்களோட உடம்ப ஹெல்த்தியா வச்சுக்கிறதுக்கு தான். கம்பல்சரிங்கிறது 2-3 விஷயம் தான். வெஹிக்கிள் லைசன்ஸ் கம்பல்சரி, ஆதார் கார்டு கம்பல்சரி, அதெல்லாம்
Public transport is running without any insurance.
கொடுத்திருந்தேன். அப்போலோல ஒரு இன்டர்வியூ இருக்கு. பட் இது இந்த புதுசு கிடையாது சார். கோவிட் மாதிரி வருஷம் சொல்லிட்டு இருக்கோம். ஆனாலும் நம்ம இன்னும் ஒரு 3 மாசம் கழிச்சு உங்கள்கிட்ட கேட்டீங்கன்னா இதை பத்தி வேற விஷயம் இருக்கும். சோ அது மாறிட்டே இருக்கும் சார். பட் திஸ் இஸ் சம்திங் வி ஹேவ் டு நோ. ஏன்னா இது நம்மளோட குழந்தைகள், நம்மளோட பேர குழந்தைகளுக்கு, நம்மளோட அப்பா அம்மா எல்லாருக்கும் பாதிப்பு ஏற்படலாம். சோ யாருக்கெல்லாம் இதை பத்தி தெரிஞ்சிருக்கோ, யாருக்கெல்லாம் அஃபோர்ட் பண்ண முடியுமோ, யாரெல்லாம் போட்டுக்க முடியுமோ கண்டிப்பா போட்டுருங்க. அது ஒண்ணுதான் நான் சொல்லுவேன். இப்போ எனக்கு மாசத்துக்கு 5000 ரூபாய் சம்பளம் வருதுன்னா இதை பத்தி யோசிக்கவே முடியாது. பட் பீப்புள் ஹூ can afford and you can get the vaccine. கிடைக்கிறது அப்போலோல வாங்கிக்கலாம், எல்லா இடத்துலயும் கிடைக்கிறது. அவங்க கண்டிப்பா இதை பத்தி தெரிஞ்சிருக்கணும், போட்டுக்கிறது ரொம்ப அவசியம். வேக்சினுக்கா? ஃப்ளூ தான் நான் சொன்னேனே சார். மெயினா ஆரம்பத்துல உங்களுக்கு தொண்டை கொஞ்சம் கரகரன்னு இருக்கும், மூக்கு ஜலதோஷம் 1-2 தடவை தும்மல் வரலாம், கடுமையா ஜுரம், உடம்பு வலி. பல வைரஸ்னால இந்த சிம்டம்ஸ் வரலாம். கோவிட் சிம்டம்ஸும் ஃப்ளூ சிம்டம்ஸும் நீங்க பிரிக்கவே முடியாது. ரெண்டுக்கு இப்போ கோவிடும் நிறைய வருது. இப்போ எது கோவிட் எது ஃப்ளூன்னு சொல்லவே முடியாது. கோவிட் வேக்சின் போட்டவங்களுக்கு கோவிட் மைல்டா வந்துடும். ஆனா ஃப்ளூ வேக்சின் போடாதவங்களுக்கு சிவியரா வந்து ஹாஸ்பிடலைஸ் பண்றதுக்கு நிறைய கேசஸ் நடக்குது.
PCR test is enough for both COVID as well as flu.
செப்பரேட் PCR டெஸ்ட். H1N1 PCR னா அதுக்கு ஒரு PCR, கோவிட் PCR அதுக்கு வேற PCR. சோ இது பண்ற டெஸ்ட் இது கண்டுபிடிக்காது. Unless you do something called a respiratory viral panel test. அந்த பேனல்ல 5 வைரஸ் இருக்கும், 4 வைரஸ் இருக்கும், அந்த வைரஸ்லாம் கண்டுபிடிக்கலாம். சோ டெஸ்டும் நான் பார்த்துட்டு எனக்கு இல்லைன்னு சொல்ல முடியாது. அதை பார்த்து கண்டுபிடிச்சாதான் அது டெஸ்ட் சோ இருக்கா இல்லையான்னு சொல்ல முடியும்.
This point which was raised by him about is there a need for an annual influenza vaccination? This point was being edited some time back. This virus changes its strains every year. So that's the reason you take the vaccine for a year. The subsequently what happens, since the virus strain has changed, there's a new vaccine which gets introduced. So when you take an influenza vaccination, it gives you protection for 1 year. The subsequent year, you need to take the new one. It's an annual vaccination. And the other point what came out is the high risk population, patients with diabetes, patients with cardiovascular disease, like for myocardial infarction. Some of this concept about adult immunization. So we know about immunization in pediatric, but when it comes to adults, elderly people taking a vaccine, somewhere there's still a big challenge. People feel that so that is one concept which we are working upon, try to address this through the media.
Are you doing any giving any free shots under the CSR program, children as well as adults?
CSR
And the vaccines, no, but
vaccines.
not for vaccines specifically, but we do have for, raising awareness on health and hygiene, which also includes, how to manage